Hi, my name is Jason Resendez, and I lead the Us Against Alzheimer's Center for Brain Health Equity. Since our founding in 2010, Us Against Alzheimer's has been building brain health equity for communities that are disproportionately impacted by Alzheimer's, yet are underserved by the healthcare system and Alzheimer's research community. This is particularly true for Black and Latino low-income women. We do this by delivering a series of high-impact programming that delivers tailored public health resources in partnership with the CDC, that fosters research collaborations between community-based organizations and trusted research institutions, and that harnesses big data to help us spot and address inequities in brain health. Our data-driven strategy is made possible by a new tool called the National Alzheimer's Disease Index. This tool enables us and our partners to understand and visualize where people of color in the Medicare program are most impacted by Alzheimer's at the zip code and county levels. Using this tool, we can identify where the highest prevalence of Alzheimer's is among African-American women or among Latino men. And we can also overlay indicators of infrastructure, such as Alzheimer's disease research centers, over this data to understand where there are gaps in access to services and research opportunities. This work is vital to ensuring that we're investing resources where they are needed the most. And this work wouldn't be possible without the support of experts who work at the intersections of data science, brain health research, and health equity. One of those experts is our first health equity research scholar, Dr. Jonathan Jackson. Dr. Jackson is the executive director of the Community Access Recruitment and Engagement Research Center, CARE, at Massachusetts General Hospital and Harvard Medical School. CARE investigates the impact of diversity and inclusion on the quality of human subject research and leverages deep community entrenchment to build trust and overcome barriers to clinical trial engagement and participation. His research focuses on midlife and late life health disparities in clinical settings that affect underserved populations. So, Jonathan, I'll turn it over to you. Can you tell us about your work to leverage data to understand and narrow inequities in research engagement among people of color in Alzheimer's research?
Yeah, thank you so much for inviting me to be here and to have a chance to address some of the folks that have supported this work. It has been an honor of a lifetime to be the inaugural Brain Health Equity Scholar. It's just wonderful to be able to kind of continue this work. So one of the big questions that we have been tackling with my CARE Research Center is something that seems to be philosophical, which is, where does research begin? Does it begin when somebody walks in the door and says that they want to be part of a research study? Does it begin when maybe a study doctor thinks of a patient that they want to involve in research? Either way, we know that lots of folks who look like you and me are left out of that equation entirely. And the problem is not just about getting researchers to ask communities of color and other minoritized groups to be involved in research, but recognizing that there's so much missing from that infrastructure to even make this possible. So my research center is really focused on trying to define and build robust protocols for everything that happens before somebody signs a consent form to sign up for a research study. And we know that by powering this kind of process and centering it on communities of color and on those who have been historically marginalized and neglected and excluded, we know that it's possible to do better. So we've taken this really strong data-driven approach that I'm very proud of to really make sure that we identify some of these selection factors, some of the measurement factors, some of the implementation factors in particular that really drive kind of the selective bias that seems to be operating when people design research projects that historically and continuously exclude folks that look like you and me.
Yeah, I love that. I think it's so important to be able to leverage data to drive and improve the system. I think what we've often heard is that, this isn't a problem, right? This isn't a problem in my community. But when you're able to say, here's some Medicare data that really demonstrates, or here's data showing that your institution and their research is not reflective of the community that you work and represent, I mean, that's a really powerful tool in making that argument to drive equity. So, Jonathan, how has the NADEX been helpful in this work and mission of the Care Center?
Yeah, in so many ways. Just to piggyback off of your point, one of the things that we've often run into that I think has been a step change from what we've seen before is historically you would come up to organizations, Alzheimer's disease research centers, neurology practices, and you would say, "Are you aware of this problem of disparity and a lack of diversity?" And they would say, "Yes, we are aware of this problem, and I promise that we're working on it." And that would be the end of the conversation. It would really be about sort of the publicly stated intent to address this issue, and there wasn't anything more that you could do about it. So, when Us Against Alzheimer's built out this NADEX tool, it was exciting because it represented a chance to try to hold organizations a little bit more accountable and to provide some data to say, okay, all of your patients are potentially coming from this very wealthy neighborhood that's in a suburb outside of your city. Is there any way that you can start to engage research participants from this other community that has a much higher prevalence of dementia or Alzheimer's disease, but you haven't set foot there in 3 years? So being able to leverage the NADEX to really start to map those data, that relate to either overall billing and kind of mapping immediate access, but also trying to map those disparities. What's really striking is how little data that there is available when it comes to trying to map out these disparities. And so that means that historically you can rely on somebody just saying that we're trying and giving you a bit of a shrug. NADEX changes the game, and it really means that we'll be able to start to build bespoke plans, and what I think is more important, really create a culture of accountability for these larger systems and institutions that have spent way too long making promises that they can't keep when it comes to diversity and access.
Yeah, I think accountability is so critical. And what more do you think the field should be doing to integrate place-based data to make it more responsive to the communities that either research centers are located in or industry is trying to engage?
When it comes to problems of neuroscience, there is a huge issue with fragmentation. And so I can go on and on about that. But even if you think very narrowly about dementia, on one side of things, you've got epidemiologists who have access to these huge resources to look at nations or states or entire communities in terms of their dementia access and care. On the other side, you've got individual care providers and clinical trialists who are usually looking for a few dozen people at any one time. And historically, there has been no way to really bridge the way that we're talking about dementia between these two very different groups who leveraged, different data sets at different sizes to make recommendations about how to combat, Alzheimer's disease and other dementias. So when we start to think about the importance of place-based factors, I think many people say, well, that's clearly an epidemiology problem. Add something like the NADEX to the repository tools that epidemiologists have and be on your way. But what's really exciting about your project, Jason, and the work that your group is doing is for the first time in the history of studying dementia, we are starting to see some nice connections between these groups that work at small group sizes and the ones that work at very large group sizes. And so there is this growing need to talk about different sorts of omics. So there's proteomics and genomics. There's also, a growing appreciation of something called the social exposome, which takes all these social determinants of health and combines them to help you understand how any one person, how their risk and how their behavior and how their phenotypic presentation of dementia may change. So the better that we get, the more resources that we have to develop something like the NADEX, gives us a chance to build up that social exposome and to finally connect together two fields that for too many decades have been operating in relative isolation on a common problem. So place-based factors are really the next way forward to understand not just social determinants of health, but to really understand epigenetic and epigenomic factors that may drive underlying dementia risk.
I love that, the way that that framework, because that's definitely been the theory behind our work. I mean, really thinking about, in order to sharpen our understanding of how Alzheimer's and related dementias impact communities of
Mhm.
color and shape risk, we have to be able to both zoom in and zoom out at some of
Yes.
those
Yeah,
systemic
exactly.
factors that are shaping not just risk, but certainly access to
Mhm.
research, access to health services, and those shape outcomes. And so that ability requires new tools and new ways of thinking and experts who get it and can help drive and power that. And certainly that's been your role in this work, and we're really grateful for that. And this work wouldn't be possible without the support of generous donors who share our vision in driving health equity through data-driven strategies and by investing in leaders who share this vision, such as Dr. Jonathan Jackson. So thank you to all the donors who've made this work possible.
So with that in mind, I just wanted to say thank you to everyone that has supported Us Against Alzheimer's, especially in establishing this Brain Health Equity Scholar Award. It has been a really wild ride being the first recipient of that. And what I wanted to say is that it didn't just drive my research, it also allowed us to create these really beautiful event series in our local communities in Boston, where I am based. So those dollars didn't just go to supporting my salary or some obscure research question. They actually supported warm, hot meals, educating individuals who never hear from neuroscientists or researchers about Alzheimer's disease. So thank you so much for providing that support. And we're really grateful for everything that you've done. Thanks.
Fantastic. Thank you, Jonathan, for your leadership, for your scholarship, and for your commitment to communities who too often get shortchanged by the Alzheimer's research enterprise and health system. Thank you.
Yeah, thank you, Jason.